So be aware of how much you're drinking during this time. There might be more opportunities to consume alcohol because we're home more, it's more available to us if we're not going into work. There's a possibility that even unintentionally we could increase the amount that we're drinking. Also, being aware of what the triggers are that it's leading to alcohol consumption can be helpful. If we're starting to drink to manage emotions, that might be a signal that there's something else going on that needs to be looked at or addressed. So there are safer drinking guidelines that are available, and they recommend that for women no more than 2 alcoholic drinks a day or 10 a week, and for men no more than 3 a day and 15 a week would be the maximum that would be considered safer. That being said, we want to watch the way we're consuming alcohol, so pacing ourselves so we're not drinking an excessive amount in a short time, having days where we're not drinking so it doesn't become a habitual thing that we do every day, and again, not drinking in situations where we're doing it to avoid stress or manage anxiety or loneliness are all ways of trying to avoid a situation where alcohol use becomes problematic. So to make sure your alcohol consumption is not increasing, it's helpful to set limits in advance and monitor how much you're drinking. Thinking about standard drink sizes is important because an ounce of hard liquor or a glass of wine or a bottle of beer is a standard drink, but oftentimes alcohol comes in containers that contain multiple standard drinks. As well, considering situations where it might be a higher risk. So for individuals who are pregnant or who are driving or operating heavy equipment, or any of the previous recommendations where are still in place, that those are situations where alcohol consumption is harmful to your health. If you are concerned about a loved one, it's important that in a caring, compassionate way, you let them know that you're concerned about them, that perhaps what you've observed is bothering you, but letting them express what's going on for them. And if they have questions or concerns about their alcohol use or their mental health, they can reach out. We have an addictions helpline and a mental health helpline that are both available to Albertans. Suddenly stopping their alcohol use could be dangerous. Individuals could be at risk for even having seizures or dying from acute alcohol withdrawal. So if you are in that situation, I would recommend reaching out to the addiction helpline first and talking to someone who can help you to plan out how to reduce your alcohol intake in a safe way.
Together, we do amazing things every day.